Tachana from Group 3 would like to present about biological hazard. Biological hazards, oftenly known as biohazards. Biological substances endanger the health of living organisms, such as humans. Biohazards can be found in almost every workplace that involves working with people, filthy settings, in laboratories, or in the environment. Although biological hazards can be found in all work situations, certain industries are more vulnerable, such as healthcare, agriculture, sewage management, veterinary services, and laboratories. Biohazards are caused by bacteria, viruses, and by airborne. These substances can cause different biological risks. Some can be small impact in nature, or some have potential of chronic diseases. Hepatitis B, Hepatitis C, and HIV are the viruses that could be transmitted from blood or fluids. For example, workers in healthcare are doing all works along with bloods and bodily fluids almost every day. If they didn't follow proper protocol or guidelines, the chances of exposure to biohazards are very high. When they are taking blood of a patient, they should wear a glove to avoid the sample to come in contact with their skin. Add to that chronic health conditions, long-term conditions, and diseases lasting 3 months or longer. Sometimes they might not have a cure. The danger of biological hazards in the workplace can be decreased in some situations. It may be removed entirely by establishing controls in healthcare sectors. Comprehensive sharp injury prevention program will include recommended guidelines, imported equipment designs, effective disposable systems, and employee training as well. Apart from that, personal protective equipment, which is PPE, should be used as a controlled approach when necessary or appropriate. In addition, working practices that safeguards workers from the negative effects of biological agents should be used so that the hazard can be mitigated. Engineering controls for biohazard risks include frequent cleaning of the workplace, insect prevention, regulating the use and wearing of safety equipment, and correct disposal of materials and substances. Administrative controls include permitting employees to take appropriate sick leave, providing an immunization program, limiting exposure to potential biohazards, and all. Once both administrative and engineering controls have been installed, your safety strategy should be reviewed at least once a year whenever the workplace conditions change. That's all from biological hazards parts. Thank you so much for.
Let's talk about physical hazards. Physical hazards are potential environmental threats that have the power to endanger or hurt living things, injure them, or destroy their surroundings or their property. The following list of typical physical dangers provides an overview. First is mechanical hazards. Moving machinery presents a risk if it is not properly guided or if safety precautions are not followed. Second is objects falling. Objects falling from a height can result in significant damage. Third is tools and equipment. If used improperly or if they are damaged, hand tools and power tools can both be dangerous. Second is causes of physical hazard. Machinery and equipment. The poor maintenance. The poor maintenance is when normal inspections, repairs and service of machinery and also equipment are neglected or skipped. Second is equipment misuse. Equipment abuse happens when tools and machinery are not used as intended or when people are not properly trained in how to operate them safely. Due to the improper or abusive usage of equipment, this may result in mishaps and risk. Third is effects of physical hazard. Accidental injury. Cuts, burns, fractures, and amputations are just few of the problems that can result from using equipment that hasn't been properly maintained or from using it improperly. Moving parts, poor electrical system and failing brakes all have the potential to cause fatalities or extremely serious injuries in an accident. Fourth is ways to mitigate your physical hazard. Risk assessment. Perform routine risk assessment to determine and assess any physical dangers present in the workplace or surroundings. Prioritize risk according to their severity and chance of happening. Personal protective equipment (PPE). Provide appropriate PPE such as helmets, gloves, safety goggles, hearing protection, and respiratory protection based on the identified errors. Ensure that workers wear and use PPE correctly and consistently.
Welcome everyone, I'm Livitamali. Today we explore a critical aspect of healthcare safety, chemical hazard in hospital. Today we will look at a crucial part of hospital safety, chemical hazard within hospital. They are chemical risk. Nursing care, which is the foundation of patient care, may accidentally expose patient to this risk. Our attention is drawn to two crucial components, rubbing alcohol and oxygen tanks. Because rubbing alcohol is flammable, it poses a possible concern. It can catch a fire when it comes into a touch with oxygen. When oxygen tanks are misused or broken, they can become dangerous. The implications of these chemical risks are severe, including burn injuries and dissipation in patient care, which could lead to anarchy in healthcare institutions. Strict adherence to safety procedure is essential to effective reducing this danger. To promote awareness and best practices, we place a strong emphasis on true staff training in safe chemical handling. A crucial preventive strategy is proper chemical storage, especially when it comes to keeping rubbing alcohol away from oxygen sources. Regular safety assessment and drills improve our capacity for readiness and reaction. Continuous education is essential for keeping everyone in the medical environment educated and cautious. We can significantly improve patient and healthcare worker safety in the hospital setting by carefully adhering to this precaution. I appreciate you listening.
My name is Maheshwari. The information offered gather around the concept of ergonomic hazard in the workplace, which are circumstances that might cause employee discomfort, injuries, and health problems. These dangers are caused by a variety of factors, including repetitive actions, uncomfortable posture, excessive work rates, and inefficient sitting. Chronic musculoskeletal disease such as carpal tunnel syndrome and tendinitis are the result of these dangers, and they are not only cause pain and suffering but also an influence on employee quality of life, productivity, and work satisfaction. Furthermore, these risks have far-reaching consequences affecting both individual well-being, financially pressure on organization. The talk covers many mitigations and controls measures to successfully manage this risk. It focuses on optimizing workplace design using adaptable furniture and ergonomic equipment, chair ergonomic, and training and education for staff to learn how to use their computers properly. Finally, the presentation emphasizes the crucial need of productively controlling ergonomic risk for both employees' health and the corporate performance. Thank you.